Greetings, and thank you for spending a few minutes to join us to learn a bit more about the coronavirus pandemic and COVID-19. Today, I have the pleasure of being joined by Dr. Farhan Khan. Dr. Khan and I have had the pleasure of working together for nearly 10 years, and Dr. Khan brings a unique insight to our COVID-19 physician team. As we talked about the small task force that is helping to keep us on the leading edge and make sure that we provide the best treatment methodologies available to our community. Dr. Khan is trained as internal medicine, pediatrics, and also critical care, as well as working as a hospitalist and a full-time nephrologist. So Dr. Khan keeps very busy, but has a great deal of insight and expertise, and also has some other unique ties to this pandemic. So once again, it's my pleasure to welcome Dr. Khan and introduce him to all of you.
As an organization at Freeport, we've been preparing for this for approximately 4 weeks, if not more. We're meeting almost on a daily basis. We talk constantly in trying to prepare for this surge that we may get. And we've taken a lot of measures. We've taken dedicated areas in the hospital and made them COVID specific, where patients are going to be specifically in those areas. And we've taken areas that are other places which are not isolated, and even our own staff members and providers that are at risk, we're putting in those areas to see patients that are there versus going up to the COVID floors. And this, in essence, is also going to help us preserve a lot of PPE. And what we try to do is, as a consultant, if I have patients that are all over the hospital, then we'll go to areas where there aren't any patients with COVID-19, and then we'll end up going to the specific area where we do have those patients. And overall, it's been a learning experience for all of us, and we are ready if we do get a surge. Hopefully, we don't. I'm from New York. I grew up in Long Island, New York, and I have been talking to many friends that are in the healthcare, and they basically, the toughest thing with this is we're going through it while we're actively in this pandemic. So we're all learning as we go through it, and they have been able to help with protocols and different trials and medications that they've been able to do. And I've been able to luckily get a lot of feedback from them and pass it on to our colleagues here, and it helps in preparation, and it helps in making our protocols for our community here at Freeport. It is very bad out there on the East Coast. As of today, almost 215,000 cases just in New York. And with the amount of deaths that we're seeing is just incredible. So this thing is very serious, and it should be taken seriously, which is very imperative on controlling this. As the same goes with New Jersey, you're seeing significant amount of cases, and all we can do is just control it and learn and see what they've done out there to help to build more for what we can do as a community out here in Freeport. Unfortunately, yes. I've had my uncle who contracted it through his work, unfortunately, and passed it on to 11 more family members. And unfortunately, I lost my uncle about 2 weeks ago from this virus. He was only 61 years old. And as far as my rest of my family, they're in their homes respectfully back in New York, and they're all quarantined into their homes. And at this point, I do speak to them. I speak to them almost every day, and it's an extremely difficult situation because even when he passed away, they were unable to see him. They could not go to the burial, and it was one of the most unreal things. We don't think of these things until it hits us. And at this point, if I can, what my aunt just keeps telling me is if I can get him back for 1 second, if I can get him back for one measly second, she would do anything for that, whether that's to stay in her room for months to years. I mean, these are exactly her words coming out. I think it's imperative that we stay at home, we wash our hands, and we follow the guidelines that are out there. It is an extremely aggressive virus, and the only thing that's showing a lot of benefits is social distancing. These are some difficult times, but if we can just stay at home, and again, so important to keep that distance, to wash our hands repetitively, if we're going outside, to wear a mask, and to protect ourselves, we will get through this. But until we don't have a vaccine and we don't have other things, that's the only thing we can do. And I can tell you from personal experience that it's if we can just do this and get through these times, we will all be fine. And as an organization at Freeport, we're doing everything we can to get this back up and running and to see people and to help them get through these difficult times here.
Well, as you might imagine, there's been a number of changes, and FHN remains adaptable, and we rapidly move to try and accommodate any of those changes. The CDC, Centers for Disease Control and Prevention, are constantly updating their guidelines and plans for organizations to utilize and respond to, as well as the Illinois Department of Public Health. And so our team has been incredibly patient and understanding and willing to accept change and do what they needed to do to make sure that we are on the leading edge for providing care. Some of the things that you might notice or that are very observable is that we've added 2 more tents in addition to our COVID-19 aid tent. And these tents were set up in place to better accommodate the workflow, make it a safer place for individuals to come while they're waiting, as well as being able to help make sure individuals were not exposed to the elements. As spring is in Northwest Illinois often unpredictable, we found that this was an important thing to do. We've also changed the traffic flow pattern, so those individuals that were used to entering off of Whistler Street and then driving straight up to Lincoln to get to our emergency department, you can no longer do that. You actually have to come right in off of Whistler Street. There you'll be met by a triage nurse who will be ascertaining signs and symptoms to decide where is the best place for you to go, whether that be to the COVID aid tent or whether that be to our emergency department. And we're running that operation now 7 days a week during the day. In the evening, the traffic flow pattern once again changes back to normal. We've also changed where we're doing our laboratory collections. So people that are coming to have blood specimens or other specimens to our laboratory will no longer do that on an outpatient basis at the hospital. And the reason why we're doing that is to try and decrease the amount of people that are coming in and out of the hospital to minimize any potential exposure or unintentional transmission of COVID-19. We are now collecting those samples at our Burchard Hills location, and that's Monday through Friday, as well as at our Highland View Drive location on Saturday mornings from 8 to 12. So once again, a number of changes that are occurring, and I dare say by next week we'll have some more changes as well. Yes, FHN currently has COVID-19 positive inpatients in our facility. Unfortunately, we also have ventilators in use as well. However, that's to be expected, and that's what we train for and are very well prepared to be able to respond to those patients' needs, as well as any other patient that's seeking care during this time. I'm hoping that we don't see a full surge, and probably something that's important to talk about is what this surge actually means to us as an organization. And for us, when we're thinking about the word surge, that means that we've exceeded our current capacity or our normal capacity. So normally we can have at least 100 patients in the hospital at any given time. If we go over that amount, we need to change our plans pretty significantly to be able to make space and be able to care for those patients. So that's what we would look at as a surge. We are expecting more of a peak, so a higher volume. So as I mentioned previously, we have a few patients, but not many, which is a good thing. What we're seeing not only in Rockford, but in Illinois, is a slowing of the doubling rate. And the doubling rate is the rate or how fast the coronavirus doubles its presence. In March of this year, I believe March 22nd, we were just over 2 days. So that meant that the coronavirus cases, hospitalizations, or death were doubling every 2 days. As of April 12th, because of all of the work that many community members are doing and the consciousness that they're showing in controlling the spread, we've been able to increase that rate to just over 8 days, which is a good thing. So the longer it takes for the virus to double, that's more of an indication that it's slowing down, which would help us accommodate the amount of patients that are coming in. Testing supplies are a big topic of discussion, and the answer is similar to personal protective equipment. We really don't know if we have enough supplies because it's based upon demand. So not knowing how many people that would be qualified or come in and meet screening for testing would be the rate limiting factor on how many tests that we can actually do. It's one of the reasons why there is a screening protocol in place, is because we do have a limited quantity of the test kits. And the test kits comprise things of different swabs, different media, and there's also different types of testing that's now available. Some of the testing has a greater sensitivity or a false positive, false negative rate than some of the other testing. And we want to make sure if a person has met that screening criteria that we're doing the most reliable testing possible. So as we look at those supplies, we are starting to see a few more become available, but certainly we're being very judicious in how we're utilizing them and when we're utilizing them. So you may have noticed a lot of workers at FHN wearing cloth masks and other masks. One of the things with the cloth masks, it's really being done to protect our patients and protect each other. So when somebody is wearing the cloth or the sewn mask, what it does is it protects that particulate or droplets from when they sneeze or cough from being spread into the environment. It's caught by that mask. It doesn't do much to prevent any droplets or any particulate from coming in when the person inhales. It's more of just that physical barrier of when they're exhaling to make sure that droplet doesn't spread. Some of the other masks that you'll see people wearing does just what I said, is it actually blocks the particulate matter from coming in, so it protects the wearer as well as the people that are around that person, so it's a two-way barrier. There are some masks, they call them the N95 masks, and they call them the N95 because they block up to 95% of the particulate matter that would be breathing in or breathing out. So it stops that flow from going back and forth and provides a higher degree of protection. Just lately, my family and I, we really don't go out in public too much because we are trying to adhere to a shelter in place. But when we do, we're very aware of social distancing. And if social distancing can't be accomplished, then we certainly want to make sure we have something to cover our faces. So my children, both my boys, have masks that they kind of play a game with those, wearing them around the house sometimes, and certainly have them with them if they need to travel. Though over the past couple of weeks, they really haven't needed to leave the house at all for any reason. When my wife goes to the grocery store, she always makes sure that she carries a mask with her. I generally have one in my vehicle, and I usually always carry one in my pocket because I don't know where I may be going. If I'm going into a patient care area, I certainly want to make sure that I have the appropriate personal protective equipment available for me. I'd like to remind the community of several things. First, as I mentioned earlier, is that we've slowed the doubling rate, so be patient. all of the steps that you're taking are working. You may want to think about it as when you take medicine, soon you start feeling better and you think, maybe I don't need to take that medicine. But as soon as you stop, then those symptoms start up again. So when you're prescribed a medicine for a certain period of time, you really want to make sure that you take that prescription until the very end, not just when stopping it when you start to feel better. And I think that's the same here. As we start to see the spreading of the virus, it's even more important that we continue to exercise our diligence all the way to the end to make sure we have this as well controlled as possible. I'd also like to thank the community for all of their ongoing support for our caregivers and for FHN in general. It really has been a we're in this together situation. There have been so many kind gestures, words, and thoughts that have been shared. It's hard to comprehend, and at times it's a bit overwhelming for our caregivers who are experiencing a lot of stress, putting themselves in harm's way to make sure that our families are being kept safe. So thank you to the community for all that you're doing, not only in controlling the spread, but for the recognition and the gratitude that you've expressed to all of our healthcare workers. We sincerely appreciate it.